Hello, everyone. I'm so pleased to be here with you and excited that we can join together virtually for our Introduction to Legislative Advocacy event. I think it's safe to say that the past year has posed so many challenges for nurses and healthcare delivery. Now more than ever, nurses need to be at the table to stand up for our values and in every arena where healthcare decisions are made. Many of these issues have existed for a long time, but have been exacerbated. Staffing and workplace violence continue to be the top issues for nurses. We continue to see inequities in the delivery of healthcare. We're seeing a system that's increasingly difficult to access and health systems that are consolidating. We're seeing federal actions like Medicaid cuts impacting our own state's approach to healthcare policy implementation. Among all of these challenges, we're seeing the increasing use of artificial intelligence in healthcare, which is changing how our patients are getting information and how our clinicians utilize technology. Throughout this, we remain committed to the position that technology can augment the work of nurses, but it cannot replace the expertise, heart, judgment, and accountability of a human nurse. And make no qualms about it, we continue to face a staffing crisis. We need each and every one of you out there. Nurses across the state are struggling to be able to provide the quality of care that they want and should be able to provide for their patients. The leaders and administrators that are placing this burden on nurses and healthcare need to hear and listen to us. As nurses, we care so deeply about providing safe, quality care to our patients. We are implementing the staffing bill that was passed in the 2023 session thanks to the relentless advocacy efforts from nurses that helped it pass. This legislation holds hospitals accountable to their staff and to patient safety. It closes loopholes on other issues impacting nurses today, such as meal and rest breaks, staffing committees, and more. We know that this does not solve every issue when it comes to staffing, which is why we need to continue to collect our stories and experiences as we move forward. This growing movement of nurses, healthcare workers, and patients are making their voices heard in Olympia right now on these issues through political advocacy, media, and community engagement. If we want to make real, positive changes for our profession, we must exercise our voices. That is exactly what we want to teach you how to do effectively here today. As nurses and humanitarians, you have a duty to care for the sick, but you also have a right to expect reciprocity and fairness in the way that you're treated.
Hi there, my name is Laurie Jinkins, and I'm Speaker of the Washington State House of Representatives. I want to start off just by saying thank you. You are seeing this video because you want to be involved in your Washington State government, and that is the most important thing that I can thank you for right now. But I do want to go forward and tell you a few more thank yous and a few more reasons why I think you should continue staying involved. You know, as I'm a public health official in my other job, and I know how important nurses are to the healthcare system. You're the center point to everything we do. But as a legislator and as Speaker of the House, I want you to know how important you are to creating policy for the people of this state. It's nurses that we have to hear from when we're making policy about patient safety and patient care. It's nurses that we really need to hear from when we think about things like workforce standards and safety for our healthcare providers. And it's you that we need to hear from when we think about the next generation of nurses and healthcare providers and how they can best be trained. You know, for the last 8 years or so, the Washington State House Democrats have said that putting people first is our focus. And I think it's really lovely to be talking to nurses because that is your whole life, your work life in particular, putting people first. So we are so aligned in this way. I think it's important to know that, you know, when you get involved in legislative work, it can seem really overwhelming and really scary, and you know, scary to show up in Olympia and to testify. You all should know that you know more about the topics that you are going to talk to us about than we know. And we understand that, and we trust nurses to tell us what the real world experiences of your neighbors are, of your patients are, of you all in your work setting are. But what we really need is for you to be willing to come down and tell us that, either if it's done remotely or done in person, to come to Olympia. So don't be afraid to do that. We welcome you. And there is a reason why nurses are considered the most trusted profession in the United States of America and in Washington State. It's because you take care of all of us, and we recognize that. So make sure that you understand that when you come down and how honored we feel to have you there. Without you coming and speaking up, we lose not only your voices, but the voices of your patients. We don't want to lose that. That is the most important part about making good policy in Washington State. And the thing that one of the many things I think we share a commitment to. So in Olympia and in the legislative process, your voice is your strongest tool. And I need to ask you to use your voice. So go to your lobby day. Come and talk to your elected officials. Share your experiences, your knowledge, your education, what has happened to you in your community, in the places that you work. Make sure to ask questions when you have them. And whatever you do, don't ever feel worried about speaking up and telling us about your experiences, because those are the things that we need to hear. And my hope is that maybe someday some of you who are watching this video will decide that you want to serve in the House with me, but we'll talk about that another time. For now, make sure to use your voice. We have so much work to do, and I'm very, very happy to be doing it with you. Let's get going.
Hello and welcome to Introduction to Legislative Advocacy, brought to you by the Government Affairs team at WSNA. This presentation is intended for nursing students and nurses new to legislative advocacy. Our goal in this presentation is to share with you why it's important for nurses to be engaged in the legislative process and how to go about doing that. In this presentation, we'll cover the following material: Civics 101, reviewing the branches of government and the legislative process. We'll also talk about the 2026 legislative session, giving you a lay of the land, what we might expect to see in Olympia this legislative session. We'll also talk about WSNA's legislative priorities for the 2026 session and what goes into determining our legislative priorities, a closer look into what that process looks like each year. And then finally, we'll talk about why nurses should get engaged in legislative advocacy, how to amplify the registered nurse voice and address nursing issues through the legislative process and create real change. Civics 101, distinguishing between the federal and state. The federal branches of government are listed here. They are, in fact, very similar to Washington State's branches of government, which we'll also cover. Here is a map of Washington State's 10 congressional districts. Each district elects one member to the U.S. House of Representatives, while the two current U.S. senators, Senator Patty Murray and Senator Maria Cantwell, represent all people in districts across Washington State. Do you know who your elected member is in the U.S. House of Representatives? Here are the Washington State branches of government. As you can see, they're very similar to the federal branches of government. Not all states look exactly like this. Nebraska, for example, calls their single-body legislature the unicameral and has 49 members total, all of them referred to as senators. Here is a map of Washington State's 49 state legislative districts. This map would lay over or under the state congressional district map with boundary lines that do not necessarily line up with each other. For example, there might be multiple state legislative districts that lie within one congressional district. So, as stated, Washington State is made up of 49 state legislative districts. Each of these 49 legislative districts elects one state senator and 2 state representatives to represent them in the state legislature in Olympia, with a total of 98 state representatives and 49 state senators. These are just a few terms that you may hear when we talk about districts and their elected officials, either in this presentation or elsewhere. Swing district, a district that swings from one party to another after elections, making them crucial in determining which party has control. There are swing districts, swing states, etc. Congressional district, or CD, districts that represent constituents at the federal level in Washington, D.C. legislative districts, or LD, districts that represent constituents at the state level in Olympia. It's important to know which district you live in when attempting to influence policy so you know who you'll be talking to. If you're looking to influence policy at the federal level, then you want to know your congressional district. If you want to know who to talk to about state policy in Olympia, then you look for your legislative district. Your district will tell you who you should direct your legislative advocacy efforts towards because they represent you in their respective bodies of government and whether you have the correct audience depending on the issue you want to talk to them about. Next, we'll review the legislative process, which is the process established by the people for the people to use in order to pass laws that govern the way we work and live. Just a few things to note on this slide. Washington has a citizen legislature, which means legislating is not their full-time jobs. They have to be able to take a leave of absence from their employment January through March or April every year in order to be able to be legislators and spend that time in Olympia. Many state legislators are business owners, attorneys, educators, farmers, retired, and even nurses. At one point, we had 8 nurses in the legislature all at the same time. Currently, we have 0 nurses in the state legislature. This is just food for thought for now. If you've ever thought of running for an elected office and would like to learn more about that, please do contact a WSNA Government Affairs staff member or email us at gov@wsna.org. We want to help support growing more nurses in the legislature or elsewhere. Another important thing to know is the state is required to balance their budget. No running deficits allowed, like at the federal level. This particular issue is going to have a huge impact on the work in the 2026 legislative session due to the rather large budget shortfall we're currently facing. Legislators must look at projected revenue or estimated money coming in from taxes and money going out or expenditures. This isn't unlike how we all run our own households when you think about it. Many of you have seen cartoons or heard songs when you were younger educating you about how a bill becomes a law. The cartoons you see featured here are from the Washington State Legislature website and review a bit of what that process looks like. One thing worth noting that is not mentioned in the cartoon is that if a bill contains a fiscal note or likely to cost the state money to implement, it will also have to make a stop at its respective fiscal committee. That is the Appropriations Committee in the House or Ways and Means Committee in the Senate. If it goes to fiscal committee, it also needs to be voted on there for passage after it passes its policy committee. If voted to move forward through fiscal committee, then it moves along to rules committee, which is the step you see featured in the third box of the cartoon here. This is not a clear-cut process, however, as amendments may be introduced along the way in committee by committee members, potentially changing its composition and requiring agreement from legislators or a majority vote in order to continue along in the process. Some bills, if controversial enough, can start to feel somewhat like a pinball in a pinball machine, as it tries to make its way through the process in the allotted amount of time. There are also very strict deadlines throughout the legislative session, and if a bill does not make it to its next stop in the process by the respective deadline, it is considered dead for that legislative session. The notes you see below each photo indicate an example of how that step in the legislative process worked for the 2023 nurse staffing bill passed in Olympia. So as you can see, this is how the process continues until a bill becomes a law. Next, we'll talk a little bit about what we're anticipating in the 2026 legislative session and why, providing you with a lay of the land. Level setting. Lay of the land in Olympia for the 2026 legislative session. We will be having a 60-day session this year, starting January 12th, ending March 12th, where the legislature will be required to pass a balanced supplemental budget. We'll also be facing an approximate $6 billion budget shortfall expected over the next 4 years. However, Governor Ferguson released his budget in December of 2025 for 2 years because it met 2 criteria. Therefore, we'll only be looking at a $2.3 billion budget shortfall in the 2026 legislative session. State law requires a 4-year balanced budget. However, Governor Ferguson laid out the following 2 criteria that allow his administration to instead produce a 2-year budget this year. 1, projected employment growth remains below 1%, and 2, the proposal relies on use of the budget stabilization account, also known as the Rainy Day Fund. Additionally, Governor Ferguson noted that while his budget does not rely on a previously discussed millionaire's tax, he does now support the concept. Ferguson was careful to note that the tax, if passed in 2026, would not provide any revenue to the state until 2029, and thus would not provide sufficient revenue to address the current budget deficit. For that reason, we are likely looking at a number of cuts this legislative session. A couple more things to note. Democrats currently hold the executive branch, or the governor's office, and the majority in both chambers of the legislature, that is the House and the Senate. And lastly, we are expecting a short and intense legislative session expected to be focused largely on the budget. The bills that WSNA tend to care about the most go through these key committees. We'll do a quick review of them and why they are key committees. On the House side, you have Healthcare and Wellness and Labor and Workplace Standards. You also have Appropriations or Fiscal Committee. Other committees we might be watching is the Education Committee and the Civil Rights and Judiciary Committee. On the Senate side, you also have a Healthcare Committee called Health and Long-Term Care. Their Labor Committee is called Labor and Commerce, very similar to the House side. And then, of course, you have the Ways and Means Committee or the Fiscal Committee on the Senate side. Similar to the House side, you have a Law and Justice Committee, and then you have a Higher Education and Workforce Development Committee. Policy committees review and vote on the policy being presented in the bills, and the fiscal committees review and assess whether those fiscal amounts are accurate and reasonable. How does this fiscal request fit into the larger picture of balancing the budget? Is it a priority and therefore should be included? Remember, legislators know they have to represent all members of their district, not just those with their same party affiliation. Legislators in Washington State take that responsibility very seriously and do work hard to be sure that they are making good decisions for their entire districts. Next, we will cover WSNA's legislative priorities for the 2026 legislative session and a little bit about what goes into determining which priorities to pursue. Here's the list of WSNA's 4 legislative priorities for the 2026 session. At the time of this recording, it is January, and some bills have been introduced, while others are still being discussed or have not yet been filed. Please visit the website at the bottom for up-to-date information on these priorities. Nurse title protection. As the use of artificial intelligence, or AI technology, grows rapidly in healthcare, so does concern about how it will impact patient care in the workforce. While AI can be a useful clinical support tool, we must make sure it never takes the place of an actual human in providing care. As patients increasingly interact with AI tools such as chatbots, transparency is essential to ensure that they know who or what is giving healthcare guidance. Without legal protections, there is growing concern that AI systems are being presented to patients as providing nursing care. Safeguarding the title nurse in law will help affirm the distinction between licensed human professionals and technology. This bill amends the Nurse Practice Act to ensure that those who use the term nurse are indeed human. Standing order for albuterol in K-12 schools. Reliable access to albuterol for children experiencing difficulty with breathing at school is a problem that school nurses continue to face. Students frequently forget or lose their inhalers, and many children and families lack preventive healthcare access when they need it. Approximately 10% of all school-aged children in the country are impacted by asthma, with a higher prevalence among lower-income students and students of color. Further, undiagnosed students may also experience their first asthmatic attack while at school. This bill would establish a statewide standing order through the Department of Health for albuterol in K-12 schools so that schools may keep an inhaler on hand for those types of scenarios. Every student should have access to life-saving medications. This bill is being championed by the School Nurse Organization of Washington, or SNO, who are an affiliate of WSNA. While there is no particular bill number associated with this priority, with an estimated $2.3 billion budget deficit to solve this session for the next 2 years, and an estimated $6 billion budget deficit overall in the next 4 years, we know we will see a significant number of cuts this session that will impact healthcare access and jobs. With that, our third priority is protect and preserve access to healthcare. We cannot simply cut our way out of this deficit. Working class and traditionally under-resourced Washingtonians will be hit the hardest by federal cuts to SNAP and Medicaid as a result of passage of H.R. 1. Piling additional state cuts onto these families will make it even more difficult for them to make ends meet. We must protect healthcare access and coverage, as well as jobs. WSNA opposes these cuts that will impact our patients and our nurses. As a state, this problem will only persist if we do not create a more balanced tax system. This priority signals to members that we are in the fight to try and help protect and preserve access to care within the budget process of the legislative session, as well as potentially weigh in on progressive revenue proposals intended to create a more balanced tax structure that does not hit the working class or the most under-resourced communities and people. Protecting workers' rights in Washington state. Due to leadership shakeups at the federal level, the National Labor Relations Board, or NLRB, has lost quorum, the minimum number of members needed to make binding decisions. This has effectively crippled many of the NLRB's normal functions and is holding back unions' ability to properly fight for their members' rights. This bill, if passed, would allow a state-based structure to secure basic collective bargaining rights for private sector workers if federal courts undermine bargaining rights, effectively triggering this state-based structure to step into place. At the time of this recording, this bill does not yet have an assigned number. Please check the WSNA website for updated bill numbers for our legislative priorities.
Hello, everyone. My name is Justin Gill, and I'm the president of the Washington State Nurses Association. I'm excited that all of you are joining me today to discuss an introduction to legislative advocacy. Really, the goal of this presentation is to provide you with some skills and some thoughts to consider as you move through your journey of becoming an effective advocate. For many of you, you have had the chance to meet with your lawmaker or policymaker in the past, so hopefully this will serve as either a review, reminder, or supplement to some of the skills that you already possess as you've met with your lawmakers in the past. So what is the purpose of lobbying or advocacy? Well, really it is to promote the legislative priorities of a specific coalition, group, or individual. So in this case, it could be the State Nursing Association, it could be you as an individual nurse, as a healthcare provider, or regarding an issue, say you're working in coalition with at a local or state level. Really, the point is to assume that the lawmaker is not persuaded or fully aware of the issue. Your role is to develop the most effective way to persuade that policymaker. Lobbying plays a major role in policy development as well. Contrary to public opinion, I know that the word lobbyist oftentimes gets a negative connotation, but it really is that primary way that lawmakers learn about a particular problem. And you don't have to be a lobbyist in order to advocate as a professional nurse. Because remember, you are the expert. If we're not speaking on behalf of our profession and priorities, other groups will be happy to speak for us on our issues. So it's important that we're present, active, and focused when we meet with our lawmakers so that we can promote our priorities for our profession and our patients in an effective way. So I do have a fun video that we'll watch at the beginning of this presentation. And my suggestion would probably be to take some notes about things you notice about Sally Sue in this video, who's a nurse that is very concerned about a lot of problems going on in her hospital, as well as some ideas for potentially improving her experience that you noticed during her presentation.
This is Sally Sue. She's been a nurse for 3 years. After getting her feet wet and learning skills necessary to carry out nursing care with ease, she began to notice certain problems in her healthcare setting. She began to really think about these problems quite frequently. It concerned her even when she wasn't at work. It bothered her so much that she felt she needed to do something about it. Finally, it dawned on Sally. She'd go to meet with her senator. One day, after getting off the night shift, Sally was so upset about this continued institutional problem that she decided to drive straight to her senator's office. Sally went right into the office and asked to meet with her senator.
Hi, I'd like to meet with Senator Jones to discuss nursing and patient safety.
What's your name, ma'am?
I'm Sally Sue from Central Hospital.
Do you have an appointment with him?
Well, no.
Okay, let me check with him to see whether he can fit you in, okay?
The staffer seemed a bit taken aback.
I'll see you at the committee meeting then, okay? All right. Okay. Yeah, that works. Okay. Bye. Yeah, she can probably walk with me to the next committee meeting. That should work. Yeah.
Okay. I'm gonna let her know.
Okay.
And I've talked to all my girlfriends at other
Yeah.
hospitals, and they say the same thing. Like, it's getting really, really bad.
Yeah. Okay. Well, is there a bill number for this, or is there any kind
I don't know if there is, but if
Okay.
there isn't, there should be.
Okay. All right.
The staffing is really bad.
Okay.
The patient safety, like, there are just so many problems.
I see. Okay.
We really need you to help Senator Jones. And
Well,
I could go on and on.
And I hear you.
Let me just say.
Yeah, this is my floor. I actually have to go to my committee meeting.
Okay.
Feel free to leave your information with Winnie, and we'll try and get back to you as soon as we can.
Okay.
All right.
Well, thank you,
Okay.
and I will
Thank
definitely
you.
talk.
Take care.
Thank
All right,
you.
bye.
Oh, poor Sally. Her heart was in the right place. She cares about her patient's safety and about the profession of nursing. But that went wrong. Really wrong. What do you think Sally could do to have a better next meeting with her senator next time?
So back to some resources here. The Washington State Legislature has some helpful tools to help you find your lawmakers and their information or committees. Do an internet search for the lawmaker to access their campaign webpage. This might have more helpful information on their background. Also, consider following them on what was formerly known as Twitter or X, Facebook, Instagram, or other public arenas. This can provide you with helpful information about who the lawmaker is, what issues they focus on, what their background is, so that way when you have that conversation with them or that communication with them, you can do it in the most effective way. Also, it's helpful to go to the website app.leg.wa.gov/district finder if you're not sure of who your lawmaker is and what district you reside in. It's important to know who both your state senator is as well as your state representatives in the House. This is an example of some of the background information about a state senator, Jeff Holy. Knowing about their background, who they are as an individual, what role they play in their local community, can help you provide some, I guess you could say, pieces of information that would be useful and that might relate to their background a little bit better. Doing this background research is really helpful, especially before you meet with the individual in person, because it could serve as a way to open up conversation in a friendly way and also find ways to find areas of mutual interest. So now comes down to that piece of the pearls of persuasion. So when you are researching ahead of time, you want to ask yourself, who is your legislator? Where are they from? What committees do they sit on? Some information about their demographics, hobbies, or interests. What is their political party or philosophy? What is their WSNA voting record in the past? Other things you want to consider when discussing issues with your lawmaker are pieces of likability and personal connection. Is there a chance you might reside in the same city or went to the same school as that lawmaker? Do you have any similar hobbies or interests that you guys could discuss as part of an icebreaker when meeting first for a conversation? Offer to work with the legislator on other relevant issues in the district or related to your profession. This serves as a way of maintaining that connection to the lawmaker as you go about working with them on various issues. So I like to think of legislative advocacy in nursing as very similar to that of the nursing model. What we do every day with our patients and our communities involves assessment, diagnosis, planning, implementation, and evaluation. This same concept model can be applied to legislative advocacy, and I would have to say to solving most problems. By understanding advocacy through this lens, this really helps us build some confidence in our ability to advocate for our patients at the legislative level. It can oftentimes seem overwhelming or daunting at first, but when you look at it through this lens, I hope that it can help instill an increased level of confidence going into some of these meetings. So that first step is assessment. So really what you want to ask yourself is, what is the problem or issue that you would be best positioned to address? Is it on safe staffing or worker protection, or safe staffing standards? Is it on equity, justice, and transparency in healthcare? Is it about ARMP reimbursements or reimbursement parity, having the same pay for same service? Are you a nurse that's going to NP school to eventually become an ARMP, and will this potentially impact your practice? Gather information or examples about your experience with the issue. These stories are really impactful. You are their constituent, and it gives lawmakers a better pulse on what is really going on in the district. Stories can be provided without violating HIPAA in many ways. You don't need to be an expert on the nuances of bill language and passage, but know the top points of a bill and how it would impact your professional practice. The next step is planning. So now that you know what your issue is, how are you going to address the issue? Is it through a meeting with your lawmaker outside of session to help foster ideas for what bill language potentially could be? Is there already a bill in the state legislature or a bill that, say, your professional association is promoting that you could help advocate for in the next legislative session? Be sure, if you do meet with your lawmaker, that you plan on what the priorities are for the meeting. Is your priority to come up with bill language? Is your priority to address legislation that's already been passed and maybe potentially fix or tweak that language? Is your priority to help promote the priority of your professional association on legislation that is the top priority for them? But also know when you do meet with your lawmaker, you might not be able to address every single issue. But by doing your research ahead of time, such as that background information on your lawmaker that we discussed earlier, you may want to choose specific pieces of legislation or ideas that are relevant to the lawmaker, based on that background that you identified, what committees they serve on, and their history on the issue. Just know when it's an in-person meeting, be sure to check in on time and be prepared for last-minute adjustments to your schedule. If it's a group meeting, which is what I would recommend for those of you that may be very nervous or uncertain about how these meetings may go, and it might be your first time meeting with your lawmaker in person, identify who might be best positioned to speak on a given issue. For example, if you have a group where really one of the focuses for that lawmaker is to talk about safe staffing issues, you may want the nurse that has experience with that directly, or that has that hospital or direct care experience, to advocate and tell their stories on that issue. Another important piece is to avoid acronyms or medical jargon. This is important because, as many of you know, acronyms run very wild in healthcare, and it is one of those things where oftentimes people who do not work directly in healthcare are aware of what those acronyms mean. So if at all possible, try to talk in the most simplistic way so that the person could understand, just like we do with our patients when we try to educate them at the bedside. It's also important to make sure that you're watching the clock. There's going to be a certain amount of time you want to budget for introductions and small talk, as well as a certain amount of time you want to really budget for getting into the meat of the topic and coming up with some solutions. If you have an individual meeting, you really may have more time to talk about your own story or personal experience with the issue, because it's just going to be you with that lawmaker one-on-one. For both types of meetings, you always want to go in with one thing that you know the answer to, and that is, what is your ask? What is your goal for this meeting? What are you going to ask the lawmaker to do by the time that you have, say, said your piece? By using this as a guide for your meeting, you really can get from point A to point B from the start and the finish of the meeting much more easily. Below are some pictures or images that you can see that if you meet online with your lawmaker, which is a great new innovative way to connect with your elected representatives, that there might be more stringent parameters around time frame. And for example, in this case, the legislative assistant is kind of giving a warning about how much time is remaining. And then we get to implementation. So implementation can be applied when you're, say, going forward with an advocacy strategy. So what is your plan in the legislature in order to get a bill through particular committees, in order to convince lawmakers in a legislative body to pass a piece of legislation, but implementing those plans that you had discussed or thought about previously also apply directly to the meeting. You can plan a lot, but once you get into the meeting, there's variables that sometimes can kind of come in that can affect the flow and the timing of the meeting. Oftentimes, it can be tempting to engage in length at small talk that's not really relevant to the issue priority. Some lawmakers actually may facilitate this, especially if they're undecided on a particular issue. It's important to remember that you should find a way to transition to the issue priority that you're there to talk about. Try to establish that personal connection, but avoid too much of that small talk. It's also important to identify why it is that the issue is important to you and what can be done about it, and how that solution really would impact you positively, as well as people in the district. It's also important to thank the lawmaker at the end of the meeting. Their time is valuable, just like our time as an advocate. And they do have other meetings that they have to get to. And the fact that they are present, or their legislative assistant is there and present to hear you out on your thoughts on a particular issue is important. One other thing that I would also make sure that I encourage is offering to be a resource for that lawmaker. Healthcare issues are very broad and vast, and oftentimes lawmakers that may not have a background in healthcare directly may want input from stakeholders. By offering to be a in-district local resource for that lawmaker, you can help build rapport, and that rapport can go a long way for developing new pieces of legislation that affect other issues as well in the future. It's always better to build a bridge than to burn one. And I think one of the most important pieces next would be nursing advocacy evaluation. So not all efforts and campaigns will come out positively or come up with the outcome that you had hoped for. But what's important is to recognize and reflect on what happened during that last meeting or that last session to understand what went well and what didn't go well. Was the lawmaker that, say, you met with, did they seem opposed or supportive of the issue that you brought up? It's also important to follow up with WSNA and provide feedback about the meeting. This will help WSNA plan throughout the session so that they know who to follow up with, which questions to answer, and also develop a better strategy for success for pieces of legislation. Just know that your skills and confidence will improve with each meeting. I still remember the first time that I met with my lawmaker, and I was terrified and extremely nervous. But by the end of the meeting, and I did meet with other nurses who had done this before, I felt passionate about the fact that I could actually make a difference and also positively impact the trajectory of a bill with just my story. So know that, remember, you are the expert in this situation, and that your story can have a much more impactful influence on how an issue moves forward through the legislature, because that's what lawmakers want to hear and want to know when it comes to the impact of legislation. So let's look at another video of Sally Sue after she has applied some of these concepts that we talked about at our throughout the course of this presentation. You can look back at some of those notes and see how some of them might apply in this video.
This is Sally Sue. She's been a nurse for 3 years. After getting her feet wet and learning the skills necessary to carry out nursing care with ease, she began to notice certain problems in her healthcare setting. Yada, 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 she got really worried. Let's fast forward and get to the point already. Finally, it dawned on Sally. She would go meet with her senator. She remembered a class she took in nursing school that gave her a template to use for political advocacy. She followed the 7 steps in order. She identified the problem. She did some background research and found out that the Nursing Association in her state had a bill in the committee regarding her very issue. She was able to print off a prepared sheet on the topic, complete with talking points. She joined her organization's political action committee. Next, she found her elected official. She found Senator Jones' contact information, his party affiliation, and his committee assignment. She found out that Senator Jones' daughter-in-law was also a nurse. Sally identified her goals. Sally spent several days really digging into the meat of the topic. She knew that her bill needed more co-sponsors. She understood the opposition's argument and developed a counter-argument. She also had a relevant personal story she was prepared to share with the senator. This was it, Sally's big day.
Hello, I'm Sally Sue from Central Hospital, here to meet with Senator Jones.
Hi, I'm Winnie.
Nice to
I
meet
am
you.
assistant for Senator Jones. I handle healthcare issues for Senator Jones.
Oh, perfect.
Okay, I'm going to check with him, okay?
Okay.
Senator Jones, this is Sally Sue, the nurse from Central Hospital.
Hi,
Nice to meet you.
Sally.
Thanks for having me.
Thank you for coming in. Feel free to take a seat.
Thank you.
Do you need any water or anything?
No, I'm good. I'm good.
Okay. Again, thanks for coming in today. Winnie told me a little bit about yourself and when you were making the appointment and that you're a nurse. And I just want to say thank you for what you do. Nurses do amazing work. And actually my own daughter-in-law is a nurse in the ICU. I think it's at Central Hospital.
That's fantastic.
Yeah, she does amazing work, 12-hour shifts. That's really difficult.
That is a tough job.
It is, but she's really passionate about it, and I really support her in that.
Well, I share your daughter-in-law's passion, and that's why I'm here today. But I do have some concerns about things I'm seeing at Central Hospital and other hospitals in the district.
Okay, we'll make sure we want to take some details here.
So here's what's going on.
Sally went on to articulate the problem she and her fellow nurses faced. She stuck to her talking points, showed the senator and his staffer a few statistics, and provided them with evidence that was in an easy-to-read format.
And Sally, you're bringing up some great points, and I hear those points. I do have to say I'm hearing something else from the Hospital Association and hospital administrators. Many of them feel like this is a local issue, and I have to ask, does there really need to be a law for this? I know that there's, you guys have unions, you have collective bargaining agreements. Can't this be handled there?
Well, that's a great question. But unfortunately, not all nurses in the state have unions representing them.
Okay.
It's district to district.
Okay.
And so, for example, truck drivers have mandated rest periods.
That's true.
To ensure public safety.
Yeah.
We're asking the same thing in this bill for all nurses to have mandated rest periods for public safety, for patient safety. It's what they deserve.
That's a good point.
This led her naturally to the ask.
So, as you can see, there are some issues with patient safety, and we have some legitimate concerns. Right now, there happens to be a bill in the House that addresses these issues. It's House Bill 2399.
Yeah.
And what I would really appreciate is your support on that bill.
Okay.
And we would even like you to consider being a co-sponsor.
Okay. Well, what do you think, Winnie?
I think that's great. We are going to look at the bill and look at the data and get back to you. What do you think?
Yeah, as Winnie was saying, I read legislation before I actually say definite yes, but we obviously have a serious problem here, and I'm glad that you brought this up. The bill, based off of what it looks like and the information you provided, I think I would definitely support it, and I would see myself co-sponsoring it. Well, thank you very much for coming in. I appreciate it.
Thanks so much for having me.
She was a voice for her patients and an advocate for the nursing profession. As soon as she got home, she promptly executed Step 6, the follow-up. Sally went to the next meeting of her nursing association and reflected on her meeting. They discussed how they might re-strategize for the future. She engaged her peers and encouraged them to meet with their representatives as well. Thanks to Sally's compassionate, caring personality and commitment to better health for all, she was able to make a difference in many people's lives. Sally did her research, was well prepared, and was very personable. Ultimately, she not only won over the senator's vote, but also secured him as a co-sponsor of her bill. Wow, way to go, Sally.
So let's get to the key takeaways of this presentation. The first, and I think most important takeaway, is that you should remember that you are the expert on your own experiences. Lawmakers never know more than you do about what it is like to do your job. Obtain background information on a lawmaker before meeting with them. Know a little bit about who they are, what their background is, what committees they serve on, and what their priorities are. It's important that well before you meet with a lawmaker, you have goals for each meeting. Be a member of your professional association and watch for updates or action alerts. As many of you are aware, we live busy lifestyles, and we have full-time jobs, and that's why our professional association is there to do a lot of that groundwork and monitoring and provide you with updates when it's important for you to be active when, say, a bill is in a particular committee or in a particular legislative chamber and it needs to move forward. Use the resources from your professional association like WSNA to assist you. Oftentimes what WSNA will do as part of their action alerts is they'll have a prepared message that you can send to your individual lawmaker in your district. There are social media posts that you could consider reposting or sharing on your social media feeds. Remember, this is your professional association that's here to focus on serving you and your professional issues. So don't be afraid to utilize all the resources that WSNA gives you and provides you throughout the legislative session and throughout the year. This is an example of the WSNA action alerts. There is a website that you can go to sign up for some of these alerts and get weekly email updates from our government affairs team. Please feel free to read through some of those action alerts as they come in through your email. And responding to action alerts can actually be very quick and efficient with the ways that WSNA provides those resources. As always, if you have any questions or concerns, please don't hesitate to reach out to our government affairs team.
Hello, everyone, and welcome to the Nurse Advocate Panel. The purpose of this panel is to highlight different nursing voices, to amplify their stories, and to illustrate why nurses engaged in legislative advocacy is so important. This is especially relevant to our nursing students and those beginning in their advocacy journeys. So we have 3 outstanding nurses with us today. Each come with varied backgrounds and experiences in the field of nursing, so that also comes with different relationships to legislative advocacy. So first, I'm going to introduce Jacob Garcia, MBA, MSN, BSN, RN, and PCCN. Jacob is a nurse at Astria Sunnyside Hospital and a nurse instructor at Heritage University in Toppenish. He is active in nursing issues, serving on the Labor Executive Council of WSNA, which oversees labor-related issues and strategies, and chairs the WSNA Political Action Committee, so our PAC, which serves as the political voice for nurses in Washington State. Jacob's labor and healthcare roots run deep. His late grandmother organized migrant workers in California alongside Cesar Chavez, and later helped found a community clinic called La Clinica, which still runs today as part of Tri-Cities Community Health. So welcome, Jacob, and thanks for your time. Next, we have Rosa Potts, BSN RN. Rosa was a clinical nurse educator and now serves on the WSNA PAC board. As a clinical nurse educator, she helped implement various nursing policies, such as the social drivers of health, or SDOH requirements for nurses, and connecting patients to outpatient resources. Rosa has experience in engaging with student nursing associations and legislative advocacy and PAC activities when she was a nursing student in Florida, and then also early in her professional career in Georgia. So she brings that depth of experience to our PAC board and to WSNA. So thank you, Rosa, for being here with us as well. And then rounding out our panel is Nicole Klein, PhD, RN, NCSN, and CNML. Nicole is a sexual and reproductive health clinic supervisor at Public Health Seattle King County. Nicole has been an advocate in the various roles she's held, serving at the Office of the Superintendent of Public Instruction, as a school nurse, and as a nurse supervisor at a hospital. So Nicole wants nurses, you all, to know that you can be an advocate at any point in your life. It's about showing up and doing the simple things, like, for example, knowing your legislative district or who your legislators are, that can really make a difference in the profession and for your patients. So Nicole is also a member of the WSNA Board of Directors. So thank you, Nicole, and welcome. Without further ado, let's hear from our nurses, and I'm going to start with Jacob. Jacob, I just mentioned a little bit about your grandmother's roots in the labor movement. So how were you influenced by your grandmother at the beginning of your journey in advocacy?
Oh, thank you for the question. I'm really excited to be here. And my grandmother was someone I really looked towards during my advocacy journey. My grandmother was a very involved advocate, helping those migrant farm workers, helping also solve a gap within her community within Tri-Cities by helping found La Clinica, which really helped with targeting the needs of migrant farm workers, their families, and anyone who was in need. She has been my inspiration and keeps pushing me forward when I think about all of the work that she has done. With this as a backdrop, I got involved early on in nursing school. I actually participated in our student legislative day, which we met with our senators, our representatives on Capitol Hill, advocating for policies and legislation that impacted me directly as a future RN or my patients directly. After my nursing school journey, I also continued to advocate on many different levels, such as in my department, within my hospital, at the state and federal level, and more specifically at the state level, on the Labor Executive Council, fighting for better nurse staffing for all of Washington State. And more specifically, fighting to be more specific about the better nurse staffing is patient to nurse ratio, so that everyone can get the quality of care that they should, no matter where they go within Washington State. And I've been advocating for that at the federal level as well. So that way, anyone, no matter where they are in the country, should be getting the same high quality care, and nurses should be able to give that high quality care. To me, advocacy is where we unlock our people power, being able to tell those who write the laws and represent us why this policy or legislation will impact us either for better or for worse, and what we could be doing to solve the problems that all of us face. It is where we get to speak our truths and where people actually listen. At the end, I hope I can help people like my grandma did, and this is why I'm really passionate about advocacy.
Thanks, Jacob. And I love what you said about people power. So I'm going to turn it over to Rosa. So Rosa, I mentioned that you had a lot of experience with student nursing associations in Georgia and Florida. So do you have any comparisons or contrasts between your experience doing legislative advocacy in the South compared to here in Washington?
Yes. In Florida, I started working on advocacy as a student, and although I wasn't a registered nurse yet, I was a registered voter, which is key. In Florida, as one of the younger participants at 30, it was noticeable that a lot of our politically active nurses were in their 50s and 60s and moving away from the bedside. So nursing students were able to bring technology like QR codes, the youth vote, and their experience within the community during clinicals. We were able to create a program, something called like a student liaison to different state nursing regions, and also for the different specialty organizations within the state. And then together we were able to collaborate on a lot of different nursing policies, even as students. So these spaces weren't only for the professionals, but also the soon to be new grads. And we didn't have to wait for more experience to begin that journey in nursing advocacy. So in Tallahassee, nursing policies were not prioritized, as our political capital and membership was less than 10% of all of the nurses in Florida. So lobby days visiting, whereas it's fun here, it was a lot of nose holding, because a lot of our legislators were folks personally that like, I could not stand this legislator, and I know they will never support our policies, but because this is politics and it's the South, bless your heart, I will fix my face and be courteous when facing them. And you kind of notice it. It's taken decades for some of the Florida Nursing Association supported policies to pass. But certainly here in Washington, it's been amazing to see such diversity in culture and age in our active members and in our legislator. Connecting with local and state leaders has been such a welcoming experience. And a lot of it's been celebration of like recent political wins. So amazing to see what an active membership and an engaged membership can really do. And legislators are actually happy to work with you. WSNA's history of political relationships and strengthened policies has led to great outcomes for nurses and patients in comparison to the South. There's a reason why when nurses relocate here, they refuse to go back. So just something to consider. What the nation does have in common, though, is the fact that advocacy is work. And then whether it's working with a supportive administration or not, we have to continue to engage with them and not take political wins for granted.
Rosa, and I love what you said about just becoming engaged and being involved. I think that's pretty relevant to our nursing students when they're looking at how to start. Nicole, so I mentioned that you are a school nurse. So how has your time at the Office of the Superintendent of Public Instruction and in the school setting influenced and shaped your advocacy today?
Thanks. I first want to point out the fact of what Rosa said. You're so true. I am from one of those southern states. I started my nursing career in the southern states, and I will not go back. And and work in a southern state if I have anything to do with it. So I totally agree with that. Going back to your question, during my time in the school setting, I began to focus more on laws related to nursing in the K-12 education. This focus deepened when I moved to the Office of Superintendent of Public Instruction, or OSPI, where I not only worked on laws affecting school health and personnel, but also collaborated closely with legislators. This experience shaped the foundation of my advocacy work. Additionally, during my tenure as president of the School Nurse Organization of Washington, or SNOIS, we acronym it, I worked hand in hand with lobbyists to ensure that legislative actions positively impact school nurses across Washington state.
Great, thanks, Nicole. And now I want to pivot to a question more about how you apply your advocacy in your current roles that you have. So Rosa, as a clinical nurse educator, how has advocacy played a role in your job, and how do you incorporate advocacy in educating nurses?
All right. So as a clinical nurse educator for a critical access hospital, it was crucial that I understood the needs of the really remote community on an island, but it was also important to know what resources the nurses needed to provide the best care. So this year, Washington State implemented began requiring SDOH assessments for all inpatients. And SDOH was the social determinants of health. And like many policy changes that fail, the rollout of this new process was rushed with little rationale and no input from bedside nurses on implementation. So of course it failed, and our department failed in assuming that like, oh, this is just a simple add-on. And we totally missed the fact that there's potential moral distress for everyone involved. Discussions on privilege, abuse, food insecurity, community, and safety can't just be yes or no check marks. If nurses are tasked to get these sensitive assessments, they want resources to implement right away. So if someone tells you, they just recently lost their home, their partner is abusive, they have no friends, and they're always hungry, you can't just say, hey, our part-time case manager will be back on Monday, so just wait until you hear from somebody. No, nurses needed to know that we actually had real resources, local resources, and that they were going to be available and accessible. So as a first-generation primary English speaker for my family and community, I know how matching resources to needs can really change someone's life. So I helped in creating a class on asking sensitive questions, focusing on why nursing, as the most trusted profession, is tasked to have this conversation and assessment, how transformational this can be, and also how nurses can take action where needs are identified. So we ended up finding a smart phrase that could be used and added to the chart where, depending on how the patient responded for their individual needs, we were able to match that with an actual local resource. And then instead of waiting for whenever case management or discharge happened, the patient had access to it right away where they can start making connections right there in their inpatient rooms. So our bedside nurses knew that they needed more. And then through their advocacy, we were able to create a better patient experience.
I love what you said about how advocacy extends beyond after a bill passed and including into implementation. So thank you for that. Nicole, overseeing clinics as a nurse supervisor, how does your advocacy play a role there? And how do you incorporate advocacy in the public health field, which is very important?
As a nurse supervisor, I oversee staff providing direct services to vulnerable communities, ensuring they have the resources needed to deliver quality care. Advocacy within my organization is a key part of my role as I work to support my team and the community we serve. In addition to supervisory responsibilities, I serve as the union chair for my local supervisors union. In this capacity, I advocate for public health policies and practices that protect and meet the needs of our community's most vulnerable populations, ensuring their voices are heard and their needs are addressed effectively.
Perfect. Thanks, Nicole. And I like how you mentioned how public health does impact patient care at the patient level too. Jacob, What does your experience as a nurse instructor teach you about shaping future advocates in the nursing field?
I think this is a great question, and it's a super important one. Luckily, I've been pretty lucky at Heritage University because part of what we teach about is social justice and empowering our students to be leaders and be the changes that they want to see in this world. Because of this, and my working at Heritage University, I noticed how important it is for our future advocates to be able to have a firm foundation that will only benefit their advocacy for themselves and for their future patients, as well as their family members that they may be taking care of. But you might be asking yourself, why is this important? This is super important because a lot of people give up on their voice or their advocacy to make change. Advocacy empowers you to speak up not just for yourself, but be the voice of the voiceless or those that don't feel empowered or are not empowered by our current systems, or in situations where they cannot speak up for themselves. And this is completely relevant to nursing. Being the voice of the patient, advocating for their wishes when everyone else is fighting against the patient wishes, is an important part of what we do. And this is even more important nowadays. Not to scare anyone, but our healthcare system is not sustainable in our current form. All is not lost. However, we need bold advocates to help shape the future of nursing and healthcare so that we can all benefit from a system that touches us all, whether we're young, old, healthy, sick. We all utilize the healthcare system and have family members that use the healthcare system. It is up to us to find solutions to the problems that we face and advocate for policy solutions at the state or federal level. For me, I have had recent examples of students who felt disempowered or felt like they didn't have a voice. And in my position and the trust that I've earned with my students, I was able to help encourage them, make sure that they felt empowered, let them know what steps they could take if they felt comfortable moving forward, and how this would follow them once they get their job as a nurse. Their ability to speak up to power everyone has, but not many people use. So you can either help make the change or keep silent and let things kind of passively happen to you. And so that's really something that I've taken away and tried to instill in my students as I deal with them and help them develop into professional nurses.
And one thing I would like to highlight with what you said, Jacob, is that the students felt like they could trust you with their challenges and their issues. And I think that's a big thing, is to build that trust and to build that relationships early.
Yes, and that was the thing too. I was relatively new in that position.
Yeah.
And so again, fostering that I think is super important for that has ripple effects downstream.
And it's the same with like elected officials, is fostering those relationships early and being there for them and building that trust. So we can talk more about that later. I do want to pivot to our next question on lessons learned and successes in advocacy. So I'm going to start with Nicole. Nicole, looking at where you began in your legislative advocacy journey, what lessons from setbacks do you have to share? And then what success story would you like to highlight for our nursing students?
Advocacy work often involves lessons learned through setbacks, such as laws not passing as hoped despite significant effort and collaboration with advocacy groups. While these can feel discouraging, they serve as reminders of the meaningful impact of the work being done. Overall, the successes have outweighed the setbacks as persistence and dedication leads to progress. One notable success in my advocacy efforts involved changing the funding mechanism for our state school nurse corps. The program had not received a funding increase in many years, posing challenges for supporting vulnerable school districts. Achieving this change required extensive conversations with stakeholders across the state and collaborative efforts with my school nurse corps nurse administrator team. This accomplishment represents a significant victory with a lasting positive impact on the state's most vulnerable school districts.
Thanks, Nicole. Jacob, looking at where you began in your legislative advocacy journey, What lessons from setbacks do you have to share? And then what success story would you like to highlight for our viewers?
Yeah, let me do a recap of everything that I've done because then it will make a little bit more sense of what I've learned thus far. So during my legislative advocacy has encompassed that both state and federal advocacy that I kind of hinted at earlier. Both at the federal and state level, I've attended lobby days, met with senators and representatives speaking on nursing issues and issues that affect the patient and those that we provide care to. At the state level, I have signed into support of our bills or policies, and then in opposition of bills or policies that would hurt our profession or our patients. I've even lobbied friends and educated them about the issues going on and requesting that they also sign in support of nursing issues. What I've learned through all of this is everything is not a zero-sum game, meaning that we don't need to get everything that we need to in order to win. And if we don't get everything, that we should just throw it all away. An important lesson for policy advocacy is learning when to compromise and what issues are important hills to stand on. For example, our latest staffing bill that we passed in 2023 was a compromise bill. It didn't contain everything that we hoped for, but it contained important forward movement, moving the needle forward towards progress. The important part of this bill was keeping our staffing committees that allowed nurses to have a voice on staffing decisions and to strengthen that voice. This helps nurses across Washington state to be on stronger footing when advocating for staffing decisions, as well as helping us get important data points that we can use moving forward to keep moving towards better nurse staffing. An important second lesson is that we can't win every time, and that's okay. We had a bill dealing with mergers and acquisitions, which is just basically bigger healthcare systems buying up smaller ones and then adding them to their bigger healthcare system. To me, this seemed like a no-brainer because this is actually the cause of increased healthcare costs, as well as these big system closing services that everyone uses, especially in those local communities, such as OB services, and a bunch of different services that they viewed as not profitable. However, we weren't able to get this across the finish line, so this was not a success. However, we learned a lot, and we learned that there might have been some unintended consequences with the way it was worded if this would have moved forward. This policy was important, but we also wanted to make sure that we got it right. So taking back what we learned from the people that voted against this bill, we're going to be able to tackle the issue in a way to get broader support and making sure that we're actually targeting what we're really getting at. And so it's a very iterative process. It's not like one and done. And again, it's okay to not win because it gives us time to be able to improve to something greater.
Yes, I totally agree with that. And like talking to people with the concerns for both of those bills and learning about what we can do better next time is very important when it comes to advocacy and especially legislative advocacy too. Rosa, looking back at where you began in your legislative advocacy journey, what lessons from setbacks do you have to share? And then also, what success story would you like to highlight for our nursing students?
All right, so Florida nurse lobbyist Barbara Lunkin taught that every day politicians make decisions affecting nurse employment, work benefits, and a wide range of issues concerning nurses. It's especially important for nurses to be part of the healthcare policy dialogue in order to maintain and enhance nurses' pivotal role in the delivery of healthcare. She highlighted that legislators aren't interested in a state nursing association's position statement. They want to know how constituents feel and how many have feedback on these issues. They don't want to talk to the lobbyists. They wanted to hear from you as an actual constituent. So one time I went to meet with a candidate that the Florida Nurses PAC endorsed, and this was candidate John F. Bush in Florida. We ended up presenting him a check, and the conversation went so well, I ended up campaigning for him. And supporting a Bush in Florida was not part of my political bucket list at all. But because we met eye to eye on many issues, and then it was the best candidate available for our PAC, it was the right choice for the organization. It was the right choice for the state. Unfortunately, he was defeated by the current president pro tempore. So it's a rule and a lesson. But Barbara was teaching her rule number 9, don't become completely partisan, because we must be prepared to live with either party and then sometimes both at once. I try to remember this, but it's hard. It's hard. So a different candidate, that was the surprise lesson. The harder lesson was for me in Georgia. I have Andrew Klein, who is our 9th congressional district rep, and at the time he was my rep. He is someone who stated that the Civil War was not about slavery. He's someone who sued the city over sheltering in place COVID restrictions while I was wearing garbage bags for PPE. He's someone who claimed that January 6th was no insurrection and resembled a normal tourist visit. And he was one of the 3 reps that voted against the Emmett Till Anti-Lynching Act. I had been to this person's office at the Capitol before, and it took me over 5 minutes to just prepare and fix my face to go in and meet with him. I met with his office staff members, but luckily or unfortunately, he wasn't in the office. And it was just hard because I couldn't get over how personally I took his politics. And as an individual, that's just an individual thing. But when I'm working on my nursing advocacy, I really have to put some of the personal on hold and then look at the bigger picture. Because during COVID times, I failed Barbara's rule number 7. Don't forget to recognize the importance of a legislator's office. And then thinking about it now, it was a missed opportunity during COVID to advocate for my patients directly, where I'm not sure where he was getting his message from, but as his constituent, as a nurse serving in our community for our patients, if I had his ear, it could have been the beginning of some conversations. Whether that would have gone one way or the other, I'll never get to know, because I couldn't move past that part to build into that relationship.
Well, I appreciate you illustrating your meetings with lawmakers you may disagree with, and just how you can keep on building those relationships for the betterment of the field of nursing and your patients. So we have one final question. And so Jacob, as we part today, what is one final piece of wisdom that you'd like to share with nursing students who are at the beginning of their careers and their journeys in advocacy?
I might give you 2. So
Okay, that's fine.
I know that getting involved early is important. For example, when I was on my nursing journey, I was involved in my nursing club, which helped me set up for being able to participate within my hospital's committees, as well as being an effective advocate for my nursing colleagues, our nursing school colleagues. This early involvement in the club and lobby day in nursing school allowed me to learn how to advocate effectively, which was directly related to what we're going to be doing as nurses. I advise getting involved early, joining your nursing club if you haven't already. If you don't have one, starting one. Joining your departmental committees when you become a nurse, if you have them, or joining any hospital-wide committees like staffing, nursing practice, workplace violence committee, and then joining a professional association, whether WSNA or some sort of other professional association that's related to whatever specialty you're going into. And participating there at either the state or federal level is going to help you so much. Being the voice and change that you want to see, because we all have a voice, but again, not many people use it, even though we can craft a better world when we all speak up. Another piece of advice is that everything that we do as nurses, whether it's billing, patient access, and Rosa kind of already talked about this, I think, all depend on legislation. And so we need to work either at the state or federal level, because all of these policies, regardless if we think that they affect us directly, can be easily taken away from us. And we have the voice and our people power to call out bad policies or things that might have unintended consequences. Again, assuming best intent that maybe they're not trying to do something maliciously. But however, things sometimes have unintended consequences no matter their motivations. And so it's easy to get disengaged with politics and policy. However, if a policy doesn't get passed, it's really up to each and every one of us to request the change and champion it forward. Only then can we get it across the finish line and use our people power.
Thanks, Jacob.
Those were my 2 pieces of advice.
They're great. Thanks. Rosa, as we part today, what is one final piece of wisdom you'd like to share with nursing students who are at the beginning of their careers and are just starting their journeys in advocacy?
So you'll be a registered nurse soon, but you are already a registered voter. Even as a pre-licensure student, I had more healthcare knowledge than a lot of my legislator. And it's not just because it's Florida, it is Florida, but everywhere else too, you don't know what their professional background is. And then being a pre-licensure student with all your prereqs done, you already have a solid science background. Within your clinicals, I was already able to understand my community's needs. I'd seen them, I'd been able to care for them. And this is way before NCLEX even pops up. So once you do graduate, and as a new grad, that means I already had 2 years of clinicals. I've already been experiencing giving care to the patients that this legislator has not had a context of. So I already carry their stories. And then year after years as a professional, and after COVID years, I hear more, I learn more, I see more. So like I could share 10, 20 years of stories, but those are ages ago. And legislators, it's not nursing professors or CNOs or state presidents' voices they want to hear. They want to hear yours as a nursing student, a registered voter, and not your perspective of when you're a ER's critical care nurse. They want to hear from you now. What is it like within the nursing school process? What are you seeing? Sometimes the RN title may scare off some folks because we are healthcare professionals, but sometimes we can sneak you all in as students and then begin to have those building those relationships to begin those conversations. And you can take them on your professional nursing journey year after year, as long as they keep getting reelected and making the right votes for us. But it comes back to the adage, if you want to hear the truth, you ask a nurse. And for legislators, they'd rather ask you as a student. So remember, you may not be licensed yet, but as a registered voter, that's what matters to legislators. So you're already ready now.
Yes, and I like what you said, Rosa, about them having that healthcare experience, you having the healthcare experience even before you received your license, because currently in our state legislature, we have 0 nurses as 0 nurse state legislators, and we used to have 8. And so who knows who's making the decisions, who's representing our voices in the legislature. And that's why it's so important for us to bring our experiences, bring our patient stories to the lawmakers, just so that we can fill in that void. Nicole, as we part today, what is one final piece of wisdom you'd like to share with nursing students who are at the beginning of their careers and are just starting their journey in advocacy?
My advice is to start somewhere, even if it's small, and believe in your abilities to make a difference. There are so many wonderful resources available to you. So many. Not just through your nursing organizations, but also from your colleagues, your instructors, and others in the nursing field who may have more experience. Start by familiarizing yourself with your legislative district, attending a nurse lobby day, or connecting with your local advocacy groups. Small steps can lead to significant growth and impact over time. The key is simply to begin.
Great, thanks. And thanks for making that accessible and approachable for our students. So that concludes our nurse advocate panel. I want to thank the panelists for their time. And also I would like to thank the viewers for your time as well. As you can see from what was just said, legislative advocacy is so important, and it begins now by showing up and getting involved. Nicole mentioned joining our annual lobby day event in Olympia, and that is a great way to talk to your elected officials, and they are the ones who set the policies that inform your profession. Another way to get involved is to donate to the WSNA PAC. Jacob is currently the chair of it, and Rosa sits on the PAC. The PAC is a great way to help build nurse political power in Washington and build relationships with candidates, informing them on issues important to nursing and patient safety. I don't know, Jacob and Rosa, if you have anything to say about the PAC.
Yeah, Again, this is our way to be able to help influence and inform policymakers regarding decisions that are going to affect us. And so this is our way of building those relationships, being able to open doors so that way we can be in the room or at least have conversations and help get people that are in the room talking about our perspectives and really talking about this perspectives of the constituents and the patients that they're going to be affecting as well.
Yes, well said, Jacob. Thanks. And then also you can become a professional association member with WSNA, which offers many benefits and areas for involvement as well. So thank you all for your time and your expertise and your intelligence. And that concludes our panel today.
You start your advocacy journey now. Small steps build into bigger ones, whether that's looking up who are your elected officials and talking to them, talking to other nurses about issues important to them, and getting involved in local campaigns and our WSNA Political Action Committee. Your voice matters, and it can be the catalyst for change.